If you've ever experienced low back pain, you know just how debilitating it can be.
It sure can. From common causes to treatment options and more, physical medicine and rehabilitation specialist with UT Physicians, Dr. Chen is joining us now to explain. This is really interesting because back pain is pretty common.
Yeah, so it affects over 80% of the U.S. population, adults. And if you look back in the past 3 months, about 10 to 25% of people will have some sort of episode of back pain. And so really when we're talking about the back, it's the section between your rib cage and your tailbone. And there are a lot of different structures there. Things like bones, muscles, ligaments, and there are also nerves that run through the spinal canal.
Well, and also what I found staggering is that lower back pain is the #1 reason why people take disability or leave from work.
Yeah, so it's really common, and there are a lot of different reasons why people can develop injuries back there, and it can definitely be severe and debilitating.
So is this kind of maybe like a weak core related issue, or how does this even happen?
Yeah, so there are a lot of different causes for low back pain, and the majority of them are going to be what we call mechanical. And so mechanical causes would be things that are affecting the muscles, like a weak core, or sometimes there can be issues with the bones, like alignment issues or genetic issues where the alignment is not right, or people have scoliosis. Sometimes it can be issues with the discs. People can develop small tears or a disc herniation that causes a pinched nerve or a sciatica. And so all these different types of pathology can definitely occur either in work-related injuries or from living the day-to-day of life.
And day-to-day life, I mean, it could be simple as even like bending over to pick something up or lifting your dog.
Yeah, sure. Or you're holding your child.
I mean, because I've heard people say, oh, I lifted my dog, I picked up my dog and I hurt myself, or so it's something as simple as that?
It can, and so I'll tell you, I was surprised that the people who come into my clinic with in the worst shape are moms and dads. They're not these football players that get into huge accidents or people who get into car wrecks. It's moms and dads, they're playing with their kids. They went to help a friend move. They were bending over to pick something up, and all of a sudden they got a huge problem in their back.
Well, and aside from the mechanical issues, Dr. Chen, there are also some things that can lead to your back being more vulnerable. Things like infections, an illness.
Yeah, so these are the serious causes that we want to really make sure that people don't have. And so if you have infections inside the bone or in the discs, things like cancer can be growing inside there. You can have kidney stones, or you can have aneurysms in some of the blood vessels around these structures in the back. It can really cause a big problem. And so distinguishing between the two is very hard to do on WebMD or hard to do at home. And so this is where really an evaluation can come in.
And the diagnosis is really simple. I mean, I guess thorough, but you need to have the diagnosis.
Yeah, and so there are a lot of different ways that we can make this diagnosis, and part of that is doing an exam. So being checked out by a specialist, a spine specialist, or a physical medicine rehabilitation specialist. We do things like a history and physical, and so what that means is we review your medical history, we look at the risk factors, we check people's strengths, see how they're moving, and then there's some testing that's available. So we can do things like x-rays, CT scans, MRIs, and all those things give us a better picture of the back. We can do things like functional testing or nerve testing, like an EMG or a nerve conduction study, and that checks how the nerves are working as they come out of the back and go down the legs.
And I know, doctor, there are a lot of different treatment options for people who are suffering from back issues, but you say that acute back pain can sometimes just fix itself.
Yeah, and so for the majority of people, having aches and pains in their back, it generally will go away after a few days. And so the way that we categorize low back pain, if we look at it on a timeline, is there's the acute low back pain, which means a few days to several weeks. There's subacute, meaning goes from 1 week to about 3 months or so, and then chronic is anything after 3 months. And
chronic back pain.
Yeah, when you get into the subacute chronic phase, if this pain is dragging on, it's at that time we want to think about looking to get evaluated.
Well,
right?
Especially if it's preventing you from going to work or just living your life or exercising.
Absolutely.
You know?
Yeah. And if there is a way, and this I'm just throwing this at you, is it better to ice or to heat? That's always a question, right?
Yeah, so a lot of times you'll see athletes with joint issues, they're always like putting on ice after the game. And so ice really is helpful for reducing swelling. So think about like a baseball pitcher who was just throwing out 100 pitches. They're trying to reduce the swelling. And so in the acute sense, ice can be helpful. When you get to the subacute and chronic phase, you really want to improve blood flow to the area, and at that point, heat is helpful.
Dr. Jason Chen, I still have a million questions for you, so I'm mad we're out of time, but thanks so much for stopping by. We will.
My
we
pleasure.
Appreciate it. And
Thanks
to schedule an appointment, more information on your screen here. You can call 888-4UT-DOCS or visit utphysicians.com.
Still to come on Houston Life, why not